Hey, welcome to the Healthcare Nation podcast. Your host, Rick Janata, here with our producer, Joe Woolworth. Joe, how are you?
I'm doing well.
You're looking good there. Riding the motorcycle lately?
Yeah, riding it today. Yeah.
Oh, nice, beautiful weather for that out there. If you are a rider like Joe and I are, please ride safe. And if you're a driver, watch out for the bikes on the road. That's our PSA for today, right, Joe?
Right.
So we've got a great show today. We're really staying focused on the theme of policy and really the payer space, which we've unpacked in the last two podcasts. And we have a great guest today, Jeb Dunkelberger. I've known Jeb for many years. We'll get into that in a second. But Jeb is the founder and CEO of ClearPoint Health, a very novel company in the captive and employer services space. And really what they do is they have a vehicle to empower these smaller, mid-sized companies and their employers' benefit solutions in a way that has not been historically out there for folks. By leveraging this innovative model, which Jeb and I are going to talk about, they focus on a constituency here. And I want to reiterate this, that I think is overlooked a lot when you get into negotiations, and that is the smaller companies, the smaller employer groups, which are the, cornerstone, I think, of the American economy. But a little bit about Jeb. Jeb, historically, his background, C-suite positions focused on the provider space, healthcare insurance space, many different companies across the board. He's passionate about creating really these value points and the tangible, upsides in the area of clinical delivery, the experience of employees and employers, and insurance risk. Not many folks can do that. Jeb's an author, wrote a great book out there. I encourage everyone to read it. It's called Rich and Dying, An Insider Calls BS on America's Healthcare Company. You can fill in the BS. Really, he tackles the issues, and I would also want to add the solutions that are working in the market. And one of the things I really applaud Jeb for is all the profits from that book were donated to paying for clinical care for underinsured employees. I've known, as I said, Jeb way back. He interned with me when I was at Duke Raleigh. Just an incredibly bright, talented person. Education at Penn, a master's in healthcare innovation, London School of Economics and School of Hygiene and Tropical Medicine and Health Policy Planning and Finance, undergrad at Virginia Tech. Just a great individual human being. I've watched this guy grow his career over time. And it has had such an impact in so many. So with that, let's welcome Jeb Dunkelberger.
Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Janata.
Okay, Jeb, so good to see your face, my friend. It has been a while. And as we say, no time like the present to catch up. How are you doing?
I'm doing great. Thanks for having me today.
Now, listen, we are sticking on a theme here that's really going into policy and the payer side of that. I couldn't think of a better expert than you to really have on the show to unpack this for so many different reasons. Obviously, what I mentioned in the intro gives you a line of sight, not only on the history and what's happening now, but I think what the future is. So let's just dig right in, because I think there's so much in, obviously, the health system side, how they're dealing with this, but more importantly, employer space and people, employees, and how they're paying for healthcare insurance and what's happening. I don't want to get into the elections, right? This isn't necessarily a political show, although we do get into a lot of policy. But so much of this is top of mind right now when you go across the board. So let's level set a bit. I want to understand the current landscape and maybe the best way to put it out there. What are the primary drivers behind rising healthcare costs for employers, particularly when you think about those smaller and mid-sized companies? Jeb, what's been your experience? What are you seeing out there in the market?
Look, I think a lot of people are going to point to one area, which is rising cost of claims. And that's an easy thing to point out, right? We can all say, oh my gosh, the cost of clinical interventions, pharmaceutical interventions, that is skyrocketing, and therefore health insurance costs more. But as you know, I always like to go a little bit deeper than that and really try to unpack the root cause. And as we look at the local markets that we're serving, what we're finding is that many of our provider partners, they are the largest employers in those local markets. But at the same time, Medicare and Medicaid seems to be growing faster as a percentage of the total patient population than the commercial book of business or the employed patients and their dependents. And if we feel at any time that the provider is being underpaid compared to their cost, they're not able to negotiate with CMS. So their Medicare and Medicaid rates are typically locked in. And what you see is really the cross subsidization being pushed back to the commercial side. And those small and mid-sized businesses are typically the most susceptible of dealing with that. And, it's hard for me as somebody that's married to a trauma surgeon and critical care doctor. I hear every day about the labor shortage that we're dealing with within these clinical settings. And, economics 101 tells us that there's a labor shortage, labor cost is going to go up. And so I'm not sure if there's truly an end in sight. So it's going to create, a need for some creative solutions.
Yeah, I love the idea of the creative solutions. I keep thinking when you talk about provider shortage as something that impacts you, obviously personally with your wife, but it's going to, I think, drive the emergence of new models of care. But we're also seeing that in your business as well, these new models of how you approach a solution set. But let me dig down a little bit deeper. When you think about the impact factor for the small and mid-sized businesses versus larger corporations, what are some of the burdens that these small business owners and small companies are dealing with specifically? I mean, this to
Yeah.
me, this is the bulk of so much of our economy and where it's always been the pride of American innovation.
Right. Right. Yeah. No, I think, it's a humbling thing when you go out and start talking to some of these small businesses and you hear directly from their HR benefit leaders who, are typically wearing multiple hats. You go to a large corporation, you'll find a VP of benefits, you'll find a chief HR officer, and they have dedicated time. They have key performance indicators that they're tied to, that the company's tracking, that all tie back to benefit costs, right? Because I think if you look at just about any company in this country, the number 2 or number 3 highest recurring cost is going to be health insurance. As you drop into those small businesses, you find that the people that are responsible for health insurance and the decisions made there are responsible for so many other things. And so they're wearing a ton of different hats and they simply just don't have the weight and leverage that we see some of the larger companies having. On top of that, there is a difference in the benefit advisors that are dealing with the larger groups versus the smaller groups. There are some wonderfully creative benefit advisors out there. And I think as you go down market into those smaller employers, what you typically find are folks that may or may not be a little bit tied into the status quo more than what you see in the larger corporations. And that's just naturally because of, is the juice worth the squeeze? When you have a small business that wants to get creative, there's not as much revenue there for the benefit advisor compared to a 5,000, 10,000 life group. And so as you can imagine, we're looking for things typically in the smaller group arena that are scalable, which means they're fixed. It means they're standardized. And it means that they lack creativity at meeting the small business needs where they are versus larger employers who typically unbundle everything that is the insurance product. And they're selecting who's processing their claims, what networks are they using, who's managing their pharmacy. And so by unzippering that product, they really are opening up a unique opportunity to create more value for themselves. Small businesses just have a really tough time doing the same thing.
Yeah, it's having that, that content expertise on your bench that you can call on at any particular time that really is, I think, a competitive advantage for these larger companies, without a doubt, which we'll talk about how I think you're filling that gap in a lot of ways. I want to go to traditional insurance models. When you think about fully insured products, there are limitations there, right? Jeb, what would you call out with respect to limitations of these fully insured? Maybe we could go a little deeper on that, on what you see and what your definitions are along those lines.
Yeah, I mean, I think, fully insured, when people ask me to define it, I always say it's what my mom thinks I've been doing since day one when I got into health insurance, because it's the classical definition of health insurance. You pay a fixed premium amount and you give all the risk to the insurance company. And for that fixed amount, the insurance company absorbs all of that risk. And then whether or not you paid more than your claims or less than your claims, you really don't know, the black box. And so what most employers are left wondering is, am I paying more than what the claims cost actually is, and how much more? And so that is actually what led to the Affordable Care Act when they came out and they started setting profit margins on insurance companies because they saw that gouging occurring. They said, we really need to regulate this. But what that did is it created this unintended incentive because now you have insurance companies on these fully insured plans that have a regulated profit margin of typically 15 to 20%. And the only way their revenue can go up now is if the claim cost goes up. If you have a fixed profit margin and you can't go past that, the only way you're going to make more absolute dollars is if the claim cost goes up. So there's this perverse incentive now at play that I think was unintentionally set up during the Affordable Care Act, which is so much good for our country, but has now created some upheaval there. And then I think as you also look at that arena, the other area of fully insured that's really important is, like I said before, it's very standardized, it's fixed. And so you're bundling all of the solutions in together, which is a really easy thing for a small business that says, I don't have a lot of time. I just need to select something that's affordable and gets me through the next renewal season. It's a great tool for that. But the problem with what's happening right now is so many small businesses are taking a step out and they're using a stepping stone called level funding, which is kind of an intermediary step between fully insured and self-funding. In the level funding world, they're getting a glimpse into what that claim cost is. And Rick, you can imagine what happens there. The minute someone peeks under the hood and says, oh my gosh, my claim cost is only 50% of what I've been paying every single year. My gosh, why am I staying in fully insured? And so the good risk is leaving fully insured. And then the bad risk is staying. And it's a really big quagmire that the industry is dealing with now, because what happens when bad risk stays, right? Those high cost recurring claimants, when they stay, that means that the overarching premium is going to go up because the risk is just requiring that. And so as we continue to see a migration of small businesses using level funding and self-funding arrangements to get out of fully insured, what's being left behind is this kind of smoldering block of risk, which is then enforcing the price increases that we're seeing now to move it exponentially faster.
Yeah, and Jeb, correct me if I'm wrong, but I think the transparency issue is a big part of this. I mean, it's almost two things. One, the historical lack of transparency, but then again, that level of expertise to have a savvy, business owner, CEO, CFO, hopefully benefits manager of a mid-sized company saying, let's dig in. I mean, it's not an easy task to even get a hold of that kind of information, right?
It isn't, I think, but that it seems to be the way that we do things in the United States when it comes to healthcare in terms of iterative change, right? So we start with this regulation, which requires, providers to post what they are getting in terms of reimbursement from all different carriers, right? So your Blues, United, Cignas, Aetnas, everything now is federally qualified or federally required to be shared. What's also interesting in terms of transparency is that benefit advisors also have to share what they are making. And so there's no more backdoor deals where you have a large insurance company that's quietly paying a consulting fee to a benefit advisor to guide and make them lean a certain way. And again, we don't see that as much today as we did 10 years ago, but that impartiality that we all assume a benefit advisor has is something that, obviously in this market, actually is not true. And we see a lot of perverse incentives from the people who are the trusted third-party advisors or benefit advisors that are sometimes being swung to lean in towards certain products that pay them more than others. So the transparency has gone both ways. They're on benefit advisors and providers. But to your point, what do you do with all that data? How do you make an informed decision, especially when you're limited with time and resources? But we're seeing some companies come out now using that data and trying to make it more palatable to make decisions with that.
Yeah. And, it makes me think the role of an advisor or consultant, someone there should be the content expertise where they can help you unpack those big data sets, understand your claims, your historical costs, and give you solutions moving forward, a remedy to what hurts you. Unfortunately, there's a gap in that. And that brings me kind of to the next section. And I know this is something that's near and dear to your heart. New approaches, new models. A little bit back where we started. When you think about innovative insurance models, specifically in an area where I know you have a deep expertise in the medical stop loss captive world, let's talk about that and how that differs from, I'd say, traditional insurance models.
Sure. Yeah. I mean, medical stop loss captives, just to kind of set this one up, is if you look at the industry today, medical stop loss, for everybody listening in, is one of those things that it helps protect both from frequency as well as severity of high cost claims. So if you have a lot of small claims, there's something called aggregate stop loss. It's just that. It's the aggregate coverage. And then you also have specific coverage, right? So for one high cost claimant, think a NICU baby, something acute, maybe a high cost cell or gene therapy, right? You got to have that protection as well. Medical stop loss is really what enables small businesses to move into the self-funded arena. And what self-funding is when they absorb all of the risk. So they say, you know what? I'm going to keep the money with me. I'm going to hold the purse strings to all of my benefit costs. I'm going to bring in a third-party administrator to administer my claims. I'm going to contract with a network. I'm going to contract with a pharmacy benefit manager, and I'm going to rebuild an insurance product from the inside out, and I can see everything. When small businesses do that, they're still susceptible to those shock claims, right? That really unforeseen acute event that could just send them into a financial tailspin. So using medical stop loss, that's the secret recipe that makes this financially solvable. And so when we bring in medical stop loss, the problem for small businesses is just like auto insurance. If you have a 16-year-old coming in and getting their insurance for the first time, most insurance companies would go, oh, this is going to be expensive for you because we're not sure how you are as a driver. As a small business, medical stop loss can be very expensive. The renewals can be huge, right? We're talking about 30, 40, 50% increases on renewals. And so for so many small businesses, going self-funding, knowing that they need medical stop loss, it's just untenable. They can't afford that. And that's where medical stop loss captives have come in. And so medical stop loss premiums in the United States for 2024 are idling right north of $35 billion in premium. And about $3 to $4 billion of that premium sits in a medical stop loss captive today. It's like one of the largest areas that no one's ever heard of, it seems. But really what it does is it allows those small businesses to pool their risk together to make insurance more affordable. So like that 16-year-old that I just said, that 16-year-old went out into their neighborhood and got 20, 30 other 16-year-olds to come together. And they came to that insurance company and said, hey, instead of just grading me as an individual driver, could you look at all 30 of us and then give us a policy based upon the fact that if all of us come together, you should have less overall claims, which means overall the premium should be more affordable. And that's what we're doing with small businesses. We're pooling their risk and allowing them to represent themselves as a larger body. And so the medical stop loss carriers that we work with realize that, and they really do give us some large, very large discounts in terms of making medical stop loss more affordable for the masses.
Yeah, I think obviously the large numbers, the scaling of that makes so much sense. Also, the alignment I think you'd get with employers coming together, it probably gives you a lot more, I hate to use the word, but influence over even behaviors of your employers, which I think is something everyone would like to have more agency over in their own personal lives.
You nailed it.
Yeah.
You nailed it. And I think, and you remind me of probably one of the most important points of a captive, which is the unused premiums, right? That typically would be realized as a carrier's profit now are returned back to the employers.
Right.
And that's what I love most about it. So they really are incentivized to act as a community, help each other. And you'd be surprised when we go to these member meetings and we get to see different HR leaders talking to each other. They're all dealing with the same things. How do we get access to better mental health? How do we deal with a high-risk pregnancy? These are things that I'm so scared to talk about as an HR benefit leader because I've heard this term HIPAA thrown at me 1,000 times. I'm not sure what I'm allowed to talk about, what I'm not allowed to talk about. And yet at the same time, I'm responsible for all of the cost, and it's, coming through this health insurance. And so that community, as well as that, financial incentive that they get back, what typically is a carrier profit, it drives a lot of meaningful change.
Yeah. And look, it makes good business sense too. I mean, when you think about this across the entire, I think, sector of HR, there's no place else where you can have that kind of return on investment financially in such large numbers than when you're dealing with your employees' healthcare, which I think is tremendous. Let me just get back to the point on transparency for a second. Would you say under these arrangements, the line of sight on transparency is better than what you would see? I mean, is that what we're seeing as well? I could say you could not have it work unless you were providing the claims data back to the employees.
Well, that really is. I mean, it's all like with the index on relatively speaking. There's no question that when you move into a self-funded arrangement, you get all of that claims data to your exact point, and you have the ability to see what's going on as an employer. fully insured, it's this black box of risk. You're not really sure. So that can also be really scary for an employer who's been fully insured for many years, and then they're moving now into self-funding. They don't really know what they're sitting on. It's not just your employees, it's the dependents, it's the spouses, it's the children. You don't really know what they have in terms of risk. But that's why captives are such a great stepping stone, because instead of doing it by yourself, you're able to step into a community that has also gone through that transition, and you're able to use the larger numbers around you to stabilize that transition. But you're right, transparency is hard, because even when you get the claim data, how many employers are trained on how to do claim data analysis?
Right.
How do they make sense of it? Is this good? Is this bad? So they really do lean on the captive to also provide the analytics and the guidance there as well.
I'm going to get into what you're doing at ClearPoint specifically in a second, but if you thought about the ubiquitous application of advanced technology in this space, is there technology being leveraged right now to look at everything from, let's say, clinical integration, cost management, in the whole claim side that you could deploy, particularly for this constituency, those small to mid-sized companies who are looking at a captive to control their own destiny? Are you seeing technology play a big part in there? I mean, in my mind's eye, I could see how it all connects, but you're in the middle of it.
Right.
I'd love to hear your perspective.
Well, let me just say this first. The medical stop loss space is a unique area of the industry that, despite being $35 billion in premium, you still see PDF files, emails, it borderline, reliance on fax machines to move information from one side or the other in the underwriting process. So at the very beginning of the process, when you have a request for proposal for a medical stop loss quote, it is quite archaic. We are seeing a number of companies moving into that space. And we ourselves even use a lot of technology, a lot of artificial intelligence for our underwriting applications. You can imagine, just looking at the previous year's claims on a book of business or on a specific employer, that's helpful. But there's so many other things from a societal perspective that now we have access to. And so we blend a lot of those different AI tools into our underwriting process. So underwriting is one area that you see a ton of technology coming into in applications that are being used now. This isn't just being talked about as a fluffy headline. This is something that's now ingrained in our workflows as well. The second area is you called it out as the integration. So when you unzipper an insurance product and all of a sudden now you're left with these component modular pieces, you do have to integrate them. Otherwise, it's a really clunky experience for the individual employees and their dependents. And so there is a lot of movement there. And then what I would say is a really interesting area is once you're live and you have all those pieces integrated, there's a tremendous application opportunity right now in the navigation space. So how do you get in front of an employee or their dependent when they're in a time of need at that point of service and guide them to the highest quality, lowest cost interventions, right? So that might just be steering them away from an inpatient opportunity versus an outpatient. It might be even explaining to them how their benefit structure is set up or how their network is set up and guiding them to preferred providers that are proven to have higher quality outcomes. So we see that we're using that technology. There's a lot of vendors in this space, but it leads to this unintended outcome, which is now we have this loose constellation of point solutions. And so navigating that is creating its own technological needs. And so the question is, when do you go a little bit too far off the deep end and need to bring it back in? But right now, I think people are just excited about the fact of we're finally upskilling an area that has been quite stuck in its ways for probably the better part of 3 decades.
Yeah, spot on points there, and I'm with you on all of them. One thing as I think through this and processes it is when you think about technology and the ability to prognosticate for a smaller mid-sized company on what their costs would be, the trajectory of, let's just say, the aggregate health of their employees. That's powerful information that you could use to, again, change the course of perhaps of not only their financial, performance, but also their employees' health by directing them perhaps to a point solution that might be needed out of evidence. What do you think of that? Is that what are you tracking with me on that?
I completely agree. I mean, I won't go so far as to call it a moral obligation, but my gosh, when you sit there and say to yourself, as most businesses do, People are their biggest assets, and a healthy workforce will always be better than a sick workforce. So making the investment in the people is critical. If you know as a benefits leader that there is technology out there that can keep your people healthy, I feel like it is a moral obligation to go and look into that and really push hard. If you believe that productivity can be increased or that the benefit cost, if you could just keep the benefit cost down, you could increase salaries and wages, right? There's a lot of really good stuff on the backside of those interventions. So absolutely, I'm tracking with it.
That's good. That's good. One area that no one can avoid during the show is when we talk about policy and many times the regulatory and economic factors with there's no way around it. So for
Mhm.
you, when I think about this and in the world of these small to mid-size employers, and perhaps with respect to ClearPoint, what you're doing specifically, let's talk about the regulatory challenges. I know there's everything from economic scaling, cost per unit on the economic side, but there's also regulatory hurdles out there. We're dealing with states, right? That's one, and we're dealing with the feds at
Right.
obviously at one level. Give us
Mhm.
your thoughts on that when it comes to really, I would say, start with the regulatory side, the economic drivers that might be underpinning a lot of those,
Yeah.
calculations.
Yeah. Well, I would say that so much of what's been put in play on the policy side today has led to a need for a third party to actually ingest that and make sense of it. One area that I'll call out is this lawsuit with Johnson and Johnson right now. You want to talk about policy, you want to talk about something that's in the headlines for the last few months. You have C-suite members of large employers that are now being classified as the causal factor or agent in high cost benefit structures for the employees. And there are employees, large groups of them coming together saying, we're going to hold you accountable, Mr. or Mrs. CFO, right? You are the one that signed the agreement with the insurance company. You are the one that did not do the diligence and look for alternatives that were out there. And you are the fiduciary on this. And you should be held responsible for the fact that our wage growth has, all but, plateaued while our benefits costs have continued at a 5 to 8 point increase every single year. And I would say that that is a pretty scary thing for employers that are in the self-funded arena, because as we all know, once those employees start coming together, and they develop those factions, I don't want to call it a coup because they're doing the right thing, right? They're speaking out for something that is objectively wrong. But what they're doing is they're holding their leadership accountable. That's probably the largest policy update that I'll give, because I think that it's causing a lot of both federal as well as state regulators to get involved. We decided to domicile our insurance company in Tennessee because of how progressive their regulation was around the insurance companies that we form, medical stop loss captives. And what we like about that regulatory environment is that they're big fans at allowing us to quickly grow our captives and what we call captive cells, which are built for individual employers or groups of employers. And they make it super easy. The tax law is really, really adjusted to allow for that type of growth. And so we see states trying to court more medical stop loss business. South Carolina is a wonderful domicile as well, where I live. And so you see that coming out. And then I think the last piece that's also interesting when it comes to policy is, as we've now seen, providers have to move forward with transparency laws, benefit advisors having to move forward with transparency around what they are making. And then you look on top of that, employers and employees holding them accountable. It's kind of a perfect storm. And what I'm expecting over the next 12 months is that we're going to see more heating up at a local level, where people are going to hold both the provider and the employer accountable for what's going on right now. And the problem that we have, that we didn't have 10 years ago, was there used to never be an alternative. You had this one size fits all mentality around insurance, and everyone's just said, it's kind of the way it is. But now, my gosh, there's this subculture that's now 25% of the market that's proven that actually there is a better way. And people are employed to actually go look and assess whether or not that's right for their employer.
That perfect storm brings me to my next point, because throughout any kind of chaos or challenge, there's always that opportunity. So let's
Mhm.
talk about ClearPoint and what you're doing there. And because I think it's right, it's clearly positioned to make such a positive difference across the board in so many ways. When I talk about new models of care, innovation, disruption, which is what the podcast is in its essence all about in the healthcare space, in the health sector, this is one of the areas where I can't think of many others besides, say, direct care, where the
Mhm.
impact factor is as great and as big. So with that, what inspired you? You know, you're CEO and founder. When you think about ClearPoint Health, what inspired you to start it? And tell me about how that journey unfolded and a little bit about that background for the viewers and listeners.
Yeah. Yeah. I mean, well, like most people that work in our healthcare space, I think everyone has their personal story. I have a personal story as well. It involved a parent that I lost to brain cancer when I was in my teenage years. And, unfortunately, what followed that was one of the largest ongoing financial assaults on my family that I'd ever seen, to the tune of about $2.4 million in collections after we had lost my stepmother. And so when I look at something like that, that invigorated me at a very early age. I went from, golfing at a little, country club to becoming the caddy at that same country club and going back to my dad saying like, this is not fair. I can't believe you lost your wife and now we're in this financial devastation. There's got to be a better way. And unlike cancer, which took her life, this is a human made issue. So it means that humans can solve it. And so I think it started then. And then I was fortunate along the way to meet people like you, who took me under your wing. You taught me so much about how the system works, the macro chess pieces that are at play. And, I kind of naturally found my way to small businesses. And I said, I've worked with large companies, I've worked with individuals, but small businesses seem to be the most susceptible to the inefficiencies of our market. And those are the ones that I felt, kind of implored to go after and help. And what really hurts a small business when they're moving into a more progressive insurance model is the high cost claim. It is the $2.4 million brain cancer patient that's going to send that entire business running for cover back into a more inefficient, high cost insurance product. And so for that, we said, let's solve that issue. Let's focus on high cost claimants using medical stop loss to protect everyone. So that's the insurance product. Let's use captives to bring people together. And what naturally occurs is as you bring them together, you create a community. And as you build those communities and local geographies, the fact that I'm married to a doctor, I think is half the fight here. But the fact that I've worked with people like you, I had the belief that providers truly are noble. They want to do what's right for their local communities. But oftentimes they don't have the bridge or the vehicle to deliver that value. And so we're leveraging our model and our company to bring providers into that insurance equation and try to remove as many of the middlemen and women as possible, because ultimately the relationship, the cost needs to be between my wife and the patient, not between me, my wife, and the patient. We need to remove more people like me and make this more of efficient of a relationship between just the patient and the provider. And so we're leveraging our company to do just that.
Yeah, I think the velocity of care in that such a compelling issue. And by the way, your comments equally, if not more, just pull on the heartstrings, because I think behind every great, company or story about a company is a personal issue. And you clearly point that out and you put it to work in such a good way. So I really commend you for that. I want to get into ClearPoint's, if I could call it a platform, because I think there's some unique features here that we talk about it. We've had conversations before. There's a win-win-win here. And when you get down into, let's say, your value proposition, the unique components of it, can you call out some specific features? I think that would be beneficial clearly for our audience, but even for those who are out there listening. Hey, maybe this would work for me. What does it look like? What are the features? If I can characterize it this way, Jeb, what's the competitive advantage compared to X?
Yeah. So I think the first thing you have to do is lay out who are the stakeholders that need to win. So the first one, most importantly, is going to be the employer and the employees. The second one is going to be the benefit advisor. And then the third is going to be the carrier that's involved, right? The insurance company that's going to be involved in this. Fortunately, through our platform, and I appreciate you saying it in such a way, we are able to do that win-win-win. And the reason why is we can make things more affordable and cheaper for the employer while maintaining the same quality and access to care that they're used to in other insurance models. So that's a win, right? Because you're making things more affordable. For the benefit advisor, these are complicated insurance models. And I will go so far as to say that so much of what's out in the market today is propaganda, guiding these benefit advisors back to the high cost, high profit margin. It's not hard to type in, one of these big insurance publicly traded companies and see a 6, 10, $20 billion year record. And oh my gosh, they're on their fifth straight year of shattering a record with new profit margins. And boy, are they making their shareholders happy. The problem is they're doing exactly what that company's built to do: reward the shareholder. I can't call that out as a negative. I'm a red-blooded capitalist at heart. But what I do believe is that we got to be careful when that is coming at the expense of 62% of Americans filing for bankruptcy because of healthcare induced debt. That's a problem, right? And so we can't have profitable publicly traded companies on the backbone of America. Our small businesses and families are breaking. And so with that, can we make the benefit advisor more efficient in dealing with these complicated insurance models? And the answer is yes. So companies like us meet the benefit advisor right where they are. And we do everything from hand-holding around training and one-on-one all the way through to actually going in together and talking to the employer and making the benefit advisor more comfortable with something that's very new to them. And then lastly, on the carrier side, if you look at the medical loss ratio, which is pretty much how they judge the health of their businesses, right? So how much of their total premium is going out to claims. It's also known as a medical expense ratio, as some people have a difficult time saying, well, why are we calling it a loss? The money's just going to the claims. Isn't that what's supposed to happen? But medical expense or medical loss ratio, when you compare the market to captives, you see anywhere between a 10 and 30% difference, where captives are running better because of the incentives that we're creating. So those employers that are helping each other, that are financially rewarded when they manage the cost of care, they are actually running as a better block of business, more profitable block of business for the carrier than the market. So the carrier is winning, the benefit advisors retaining that business. They're bringing something progressive and new to the market. So they're seen as winning. And then obviously when you make things more affordable while maintaining cost and quality and experience, the employer wins as well.
Yeah, there are so many wins, not to overuse the word. There's no doubt about that. I would also, I think, point out, aside from, the provision of clinical care, getting folks access, all of that, that assisting the benefit advisors, creating a more consultative approach, giving them that content expertise, I think that's a big part of credibility, and being beyond a fair and honest broker, but a source of truth, a guidance in a market that is fraught with lots of different choices, some very good, some very bad. I think that's a real value add across the board here, Jeb. So I commend you for that. I wanted to ask you, without divulging any specific company or any detail, any success stories you can call out with your early experience with ClearPoint and what you're doing?
Absolutely. I mean, we are fortunate in the fact that we get to see employers that are coming to us facing 10, 15, 20% renewals on the expense of their insurance products. And they are getting a cheaper, more affordable, at the same time, parity in terms of access to care networks. We've seen this multiple times. And the first few you celebrate and you get really loud about, and then the next few you start to develop an expectation, and now it's become the standard.
Love to hear that. That's good. The role of medical stop-loss captives and the evolving and broader healthcare insurance market. What does the future look like? You alluded to it earlier. It sounds like it's the best kept secret. I don't want to give it away here, but we do talk about the markets here sometimes. So what are your thoughts on that?
Yeah. I mean, when you look at, 2010 or 11, the medical stop loss market was about $7 to $8 billion in total premium. You fast forward now all the way to 2024, you're north of 35 billion. I mean, it is one of the fastest growing segments of all of American healthcare. You're talking about somewhere between a 10 and a 15% annual growth rate. So what I see coming into the future is we're going to continue to see more employers moving into this space. If it's not, more efficient and at least saving them money, at the very least, it's more transparent. And so I think that there's a lot of employers that say, I'm okay if I have to spend the money. I just want to know where it's going. And I want to be able to look at every single part of the insurance model. And I want to be able to say whether or not I deem that valuable. And I want more control. So I think gone are the days of folks just saying, oh, I'm going to throw up my hands and just sign the renewal and be good with it. I also have to give credit to the millennial and Gen Zers, of our American workforce who now make up more than 50% of the American workforce. And in the future, my gosh, by 2030, I think it's projected to be about 65% of the workforce. These are folks that are used to getting online, going into forums, communicating with each other and saying, no, the status quo doesn't work for me. I don't care that my grandparents or my parents did it this way. I'm not doing it this way. And it's not just the gig economy that's growing, but it's also these HR benefit leaders that are now in their late 20s, late 30s, early 40s, and it's just in the new surge. And that generational difference is big because they, forgive my French here, but they are willing to say BS, right? They're willing to call it. They're willing to say, I want to look for something different. And they're willing to upset the apple cart. And so I think you have the societal kind of undertone that's coming up. You got medical stop loss growing at an unprecedented rate. You're creating more transparency. And so what's not to like about that model? And now naturally people are going to say, well, of course there's a catch. There's always a downside. And the downside is this. If you step into that model and you have a number of sick employees that you or dependents and that you, the employer, do not want to manage, you don't want to proactively outreach to them and surround them with more services to help them better manage that cost, then you might need to stay in a fully insured model. But for the folks that want to be accountable and for the folks that realize people are their biggest assets, and that in fact, with the workforce the way it is today, my gosh, the best way to attract and retain talent is to keep them healthy, mind, body, spirit, all of that. And so as we see companies investing there, we see them wanting to get the reward of that by being in a more transparent insurance model so they can deem those savings to actually go towards wages and not go to yet another publicly traded insurance company's profit margin and, quarterly earnings report.
I'm so glad you called out the demographics with the millennials, Gen Zs. It's so important. We talked about this a couple podcasts ago. In fact, it comes up in virtually every show that we do. And what I'm most struck with is, and I said it earlier, the opportunity of agency over your own healthcare in many ways enabled by technology. And this is a generation that gets it. And if you could create actionable steps, have a platform where employers could leverage so they can give their employees, I think, the most important benefit of all, which is the opportunity to stay in good health. That is the value proposition, at the end of the day, that's it, full stop, man. So again, great insights on that. One piece I wanted to pop back to is when you think about ClearPoint specifically, what are you most excited about when you think about the industry, where you're at, and what is in front of you?
Well, I'm going to be selfish at first, and then I'll give you kind of the broader statement. What I selfishly am most excited about is I found something that finally I feel like it's my life's work. Like it's so rewarding to be able to wake up in the morning and pour your heart and soul into something and know that you're helping people that you'll never meet. For me, that's like the most beautiful concept of all. As we've talked about before the show, I'm expecting, my firstborn son here in another week. And, I want to be able to set an example for him and to be able to work really hard at something and spend myself on a worthy cause. I can think of no greater gift in life. Now, as you kind of think more broadly about the company, what I'm excited about with ClearPoint is we have seemingly put together one of the most remarkable teams of not only talented industry veterans, but also just phenomenal humans. I mean, people that you look at and go, how did we find so many good people and convince them all to join the same company? So where ClearPoint is going is I can say this, we're going to help a lot of businesses. Our target is to reach 1 million plus individual employees. And so how we get there is through a myriad of different products and different strategies. But I'm excited about that because I can tell you that I'm able to walk into any employer and look them straight in the eyes and tell them that we are doing everything above board, that we're transparent with our cost, that we are genuine with our intentions, and that above all else, we believe that they are the owners of the dollars that they are spending on health insurance, and they deserve to have full control. And when you can walk in with that level of integrity, I couldn't always do that. I've worked at a number of large insurance companies and didn't always feel that way. So to be able to say that I'm morally aligned with the objectives of our company and that we have people that actually raise that moral standard to a whole new level, I can just say that I feel very fortunate to be in this position right now. And I look forward to reaching more people because I truly can say that we're going to make a positive difference. We might not meet everyone that we affect, but I will tell you that they will feel the way that we affect them.
This is the end of the show, and this is the pay it forward segment. And I think back of you being a young, incredibly enthusiastic, talented, and gifted intern when I was in the C-suite, and you came on board, learned everything. Clearly, your life's path, experiences, what you've done, it's been incredibly impressive. With that comes an incredible amount of learnings. And Jeb, I want to turn it back to you and say, with that, give us your personal insights for the young folks who are listening, as well as the established C-suite leaders who want to learn from your experience as a CEO, as a founder of a company. There's a lot of startups out there right now who are struggling. Some have made it. Some are dealing with all of the issues that you talked about, and some. What is the advice? How would you wrap it up and give it as a gift, if you were going to say to our audience, with respect to, hey, here's what's worked for me, and here's the advice I have for you?
Yeah, no, I appreciate the opportunity to answer that. What I would say is no matter what, I think that if you don't operate this way, you should, which is just a heavy, heavy dose of daily humility. Know that most everybody that works in healthcare has a positive intention. And it just so happens that it's not the people that are messed up in healthcare, it's the system. The system is actually perfectly designed to what we're getting out of it. So when people blame the outcomes and say, oh, there's so many issues, right? Well, look at the system. Look what we've created. It's a human-made system. So like I said earlier, we can solve that with humans. So it's about keeping the faith. Recently I was sitting with the team, and so one of our new employees said, what's the one thing I should do and not do at ClearPoint? And I think that, more broadly speaking, I'll say this for all people in our industry, which is one thing you should do, right? Is I believe that we have to practice what we preach. We get up in these, opportunities to get on podcasts and talk about it. But what's harder is waking up tomorrow morning when there's nobody talking to you like this and doing the hard work, right? I think about the old analogy of how bamboo grows, right? You water it for 5 months, and then the next month, at 6 months, it'll grow over 90 feet. So you got to be willing to just water that dirt and trust that eventually you're going to get a return, right? That delayed gratification. So keeping the faith, stepping into that, I think is really important. And what I told this new employee, and I'd say to everyone, is don't wait. Whatever you do, you have to take action. I think we all know, if we work in the healthcare space, how fragile life is. I'm reminded of that every day by my wife. And, the trauma surgeon in her reminds me of how precious this is. And so the opportunity to be able to inject positive change into the system that needs it, to know that there's so many Americans out there that don't have the slightest understanding of how to fix this issue that we're in, and they depend upon people like you and me to push the ball forward. I feel like it's one of the greatest opportunities for us to own and realize over the next few years. So I have the faith right now because I see the difference happening. For some folks that are stuck in the larger parts of the machine and they don't always see it, I'd say stick your neck out, look around, reach out to people on LinkedIn. The way you and me found each other was through a very random connection. We were both willing to have a conversation, and it made all the difference in my life. And so I can just tell you, thank you, Rick, for that. And I hope that has some positive impact on the people listening.
Those kind words and sage advice as well. Jeb, I can say this. I'm so proud of you, having known you for so long, for what you've done, for what you're doing now, and probably most importantly, for what you will do and continue to do. Chief among those things is welcoming a new baby into the world, a new family member, and being a father, which is fantastic. So thank you, my friend, for a great show, great information and insights, and we'll touch base again real soon.
Thank you, Rick.
The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.